Hello everyone, this is Jasmine Ramones, your student nurse, and for today's video, I'll be demonstrating a head-to-toe assessment. So prior to performing this procedure, we want to perform proper hand hygiene, gather all the equipments needed for the procedure, and also if there's a curtain or doors in the room, you want to close them in order to provide privacy. Afterwards, we can now proceed to identifying the patient. Good afternoon, ma'am. I am Jasmine Ramones, your student nurse. Ma'am, may I ask what your name and your birth date, please?
Juliana Ramones, November 11, 2007.
So after having ensured that we had the correct patient in front of us, we can now proceed to explaining the purpose of the assessment. Ma'am, how would you like me to call you today?
Juliana is fine.
Okay, Juliana, I need to perform head-to-toe assessment. I will be obtaining your weight, your height, and also be checking your vital signs. I will going to assess your head, your neck, your facial features, your heart, your lungs, your abdomen, and your lower and upper extremities, and also your neurological functionality. Why do we need this? We do this in order to ensure that there are no signs of abnormalities and everything is normal. And if there will be a sign of abnormalities, we're going to take note of that in order to prevent further complications. Do you have a questions before we proceed?
None, nurse.
Okay, so can you tell me where we are?
At the Ramones Hospital.
Can you tell me what we're going to do here today?
Head-to-toe assessment.
And who's the president of the Philippines?
Rodrigo Duterte.
Okay, thank you for that. She answered all those correctly. My patient is alert and she is oriented times 4. She knew who she was able to tell me her name, her date of birth, where she was, what we're going to do, and current events. So I can chart that my patient is alert and oriented times 4. So before we begin, I would like to ask some questions. Have you noticed any problem with your skin?
No, nurse.
Okay, any problems with your facial features, your visual and hearing?
None, nurse.
How about your digestion? Problems with personal hygiene?
None, nurse.
How about your mental and emotional state? Have you been experiencing stress or anxiety?
Also no, nurse.
Okay, Juliana, are you having any pain? From scale 0 to 10, 0 from having no pain at all, and 10 being the worst pain you've ever had.
No pain, 0.
Okay? Okay, now we'll be starting by assessing your general status, and I will going to start by checking your height and weight. Okay, can you please stand up for me and go there to get your height? Okay, 159 cm. Next, can you please go on the weight scale? Please remove your slipper. Okay, so 41 kilos. Thank you for that. Now, I will going to compare your height and weight, okay? So, your weight is 41 kilos. And your height is 159 cm. So, I will now going to compare your height and weight. Okay, so your BMI is 15.8, which is you are an underweight. Now, I will going to proceed to check your vital signs. First, I will going to check your temperature. So her temperature is 36.3, which is normal. Next, we can now proceed by checking her oxygen saturation. So her oxygen saturation is 98%, which is normal. Next, I will going to check your pulse rate. So her pulse rate is 88 beats per minute, which is normal as well. Now we are going to obtain your blood pressure. Your blood pressure is 100/70, which is normal also. So after assessing your general status, I can now proceed with the head-to-toe assessment. First, I will going to inspect the head. I'm looking for the skin color. It is nice and pink. I will also going to make sure that the head is at the same size as how it should be for the body, and it is. Okay, very good. And I'm looking for any abnormal movements or twitching of the face that she can control or involuntary. And it is none. And I'm making sure that the face is symmetrical. It is symmetrical. There's no drooping on one side. None. And this can be seen in Bell's palsy or in the stroke. I'm looking at the eyes and ears. And they are at the same level. After that, I will go to check for the facial expressions and test cranial nerve 7, which is the facial nerve. Juliana, can you close your eyes tightly? Can you smile? Can you pop out your cheeks? Can you frown? Can you relax your face? Okay, so she did that with is that cranial nerve is intact. Next, what I'm going to do is I will going to palpate the head, the cranium. I will go to check for any masses, indentations, look for skin breakdown, any infestations, and for this part, I will go to wear my gloves. So after donning the gloves, we can now proceed with the assessment. Juliana, I'm going to touch your head. Is that okay?
Yes, nurse.
First, let's look at the hair. So what I am doing, I'm feeling for any masses, indentations, and skin breakdown. I am also checking in the head back. So hair looks good, no lump sessions or infestations. Shape is normal cephalic. Is it okay for you if I will going to touch your face?
Yes.
Okay. So I will going to find the temporal artery and I will going to palpate them bilaterally, and they are both found right here. And while we are right here, we are going to check cranial number 5, which is the trigeminal nerve. This nerve is responsible for many things like mastication. Okay, Juliana, what I want you to do is, can you clench your teeth like bite down for me? And I'm going to feel the masseter muscle, which right here. Then feel the temporal muscle. Okay, Juliana, can you open your mouth against my resistance? Okay, and she can do that. Very good. Next, I will feel the temporal mandibular joint. Juliana, can you please open and close your mouth? I'm feeling for any breathing or clicking sensations, and I feel none. Palpate the sinuses. Okay, so Juliana, I'm going to put pressure on these two sinuses, and you will tell me if you feel any pain, okay? So the maxillary,
None.
the frontal.
None.
Moving down to the eyes, and I will going to inspect the eyes first. I'm looking for several things at the eyelid, at the sclera, which is white of eyes, the iris, looking also at the pupil, and at the conjunctiva. As I can see, there is no any swelling of the eyelids. Her sclera is white and shiny. And when I pull down the conjunctiva, Juliana, can you please look up? The lower lid is nice and pink. As I can see, her eyes are equal in size and round. Her eyes are normal. There's no strabismus or anisocoria. Next, we will be assessing the number 3, 4, and 6 cranial nerves, which are the oculomotor, trochlear, and abducens. The oculomotor is responsible for eye movement, upper eyelids, and the constriction of pupils. The trochlear is responsible for the movement of the superior oblique muscle, and the abducens is responsible for the movement of the lateral rectus muscle. Juliana, I will use this pen light. And what I want you to do is look at my eyes directly. But before that, if it is okay, I will going to dim the light for the assessment.
Yes.
Thank you. So, what I want you to do, just look straight at me. Don't do anything. Don't move your eyes and just relax. I am now going to shine the pen light. Okay, constricted on the other side also, the left. Constricted also. Okay. So, Ma'am Juliana, your eyes are normal because the pupil are constricted. Okay, so next, Juliana, I am going to put the pen light on the middle, and I want you to do is don't move your head. Just follow this pen light where it will go. Just follow with your eyes. Do you understand?
Yes.
Okay, thank you. So, here. Very good. So next, I will going to perform, which is the 6 cardinal fields of gaze to evaluate the 6 extraocular muscles of my patient. What I want you to do, Juliana, is keep your head straight. Just relax. Don't move your head and just follow where the pen light will go. Okay? Okay. Next. Very good. Very good. The assessment showed that the pupils are equally round, reactive to light, and accommodating, and my patient is normal. But if there is a misalignment of the eyes, which may occur in the horizontal or vertical or along the torsional axis, that will be strabismus. But if there is a rapid involuntary or rhythmic movement of one eye or both eyes, then there is a nystagmus. Next, we're going to move to the ears. As I look and inspect on the ears, there's no abnormalities and there's no redness. Okay, Juliana, are you having any pain with your ears lately?
None, nurse.
Okay. Sometimes we may encounter patients who have had long-term gout on the helix of the ear. They may have a tophi, which is an accumulation of whitish or yellowish uric acid crystal on the skin. Next, we're going to palpate on the ear. Juliana, tell me if you have any tenderness whenever I do this. Do you have any pain
None.
or tenderness?
None.
There's no abnormal masses or lesions. Does this hurt?
None.
Does this hurt, Juliana?
None.
Okay, so no pain or tenderness. Then I will go to palpate the mastoid process, and I can see there's no swollen or redness. I will going to palpate the mastoid process. Does this hurt, Juliana?
None.
Next, let's assess the 8 cranial nerves, the acoustic or vestibulocochlear nerve. This is a sensory which mediates hearing and balance. So first, we'll perform the whisper test. Juliana will be assessing your hearing, and we will be performing a whisper test. What I want you to do is close your eyes, and I will going to cover one of your ear and repeat what I say loudly. Okay, do you understand?
Yes.
Okay, thank you. So, pizza.
Pizza.
Okay, on the other side.
Milk tea.
Okay, very good. Juliana, can you lift up your head? And we're going to look inside of your nose. As I can see to my patient, there's no redness, there's no drainage, and there's no signs of the deviated symptoms. We're going to assess cranial nerve number 1, which is the olfactory nerve. First, ask the patient to clear out her nose to remove any dirt. Ma'am, Juliana, what I want you to do is that you will going to sneeze on this tissue paper so that we can remove any dirt with your nose. Thank you for that, Juliana. So what I want you to do is to close your eyes and I will let you to smell something and say to me what is it. What is this, ma'am?
Coffee.
Very good. So my patient has a normal olfactory nerve. But if you encounter a patient with an inability to smell or is not able to identify the correct scents, the patient has anosmia. Next, I will be inspecting the mouth, but first, let's test the cranial nerve 12, which is the hypoglossal nerve. Juliana, can you stick out your tongue side to side? Okay, so she does that with ease. Next, I will going to inspect the inside of the mouth. Can you open up your mouth? Okay, so as I can see to the mouth, I don't see any sores and it is nice and pink. There's also no lesions. Can you please stick out your tongue? Okay, so the tongue is pink and nice and I can see there's no lesions. Can you please lift up your tongue for me? The underneath of the tongue, there's no lesions also and there's no cavities. Looking also at the hard and soft palate, and I'm also looking for the uvula, which is in the midline. Next, I will check the cranial nerve 9, which is the glossopharyngeal. Juliana, can you please say for me? I am checking the uvula, it is in the midline. And then I will going to check for the gag reflex. Okay, Juliana, I will poke the end of your throat. Is you?
Yes.
Okay. Okay, you can close your mouth. Sorry for that. Then, the cranial nerve 10, which is the vagus nerve. The vagus is intact because he's able to talk with me without hoarseness and is able to swallow. Now, moving on to the neck, what we're going to do is we will be inspecting the neck first. Juliana, can you please tilt up your head? We will be looking if the trachea is in the midline, and it is in the midline. There's no lesions, there's no lumps, and like what in the thyroid, you can now move. Like what in the thyroid problems like goiter. And I don't see any of that. Next, we're going to test cranial nerve 11, which is accessory nerve. Okay, Juliana, can you please move your head side to side, up and down? And she does that with ease so that cranial nerve is intact. Then we're going to place her at a 45-degree angle and we're going to turn her head to the side. What we're looking at is the jugular vein. So we're looking for any jugular vein distension. So Juliana, I'm going to turn your head to the side, okay? We're looking for any distinction of the vein and I don't see any of that. Next, I will going to palpate the trachea just to confirm it is in the midline. So the trachea is in the midline. Do you feel any tenderness?
No.
Okay, so I don't feel any lumps on the trachea and the neck part. Then next, I will going to palpate the lymph nodes. Okay, Juliana, as I do the process, tell me right away if you feel any tenderness. Do you understand?
Okay.
I'm gonna start the preauricular, which is right in front of the ears. Then in the back of the ears, the postauricular. Then on the occipital, the carotid, jugular digastric, then in submandibular, and then the submental, to the superficial cervical, deep cervical chain. Then I will go into the posterior cervical and then right above the clavicle in the supraclavicular. So my patient doesn't feel anything and no tenderness. Next, I will go into palpate the carotid artery. So the carotid artery is nice and bounding on the other side. It's also the same, 2 plus, same strength. Next, I will go into auscultate the carotid artery, one side at the time. Okay, Juliana, I want you to breathe in and breathe out and hold it for me, okay?
Yes.
And we will going to use at the bell side. Okay, I didn't hear any breathe on the other side. Can you breathe in, breathe out, and hold? It's the same. I did not hear any breathe also. Now let's move to the upper extremities. I will go to inspect the extremities and I can see there is no wound, there's no swelling, there's no lesions or any redness. Next, I will go to palpate the radial artery. And they are 2 plus, very good. Now let's move to the upper extremities. I will go to inspect the extremities. As I can see, there's no swelling, there's no wounds, there's no lesions or any redness. Next, I will go to check for the capillary refill. And it less than 3 seconds. And just by looking at her nails, they are short, round, and clean. And I will also pinch the skin. And it also fast to goes back. That was good. Then I will going to look the range of the motion of the fingers and the hands. There's no abnormalities like herpeden or Bouchard nodes, which are found in osteoarthritis. Do you feel anything like that, Juliana?
No.
Next, I will go to palpate the brachial artery and it's found in the bend of the arms. It is equal and it is 2 plus. Then I will go to test for the muscle strength. Okay, Juliana, what I want you to do is squeeze my fingers as hard as you can. Okay, that was really good. Then I want you to push up against my hands. And I will go to push yours. Okay, that was really good. And 5 plus normal strength. Next, I will go to check for the drift. Juliana, I want you to hold out your arm like this and close your eyes for 10 seconds. Okay, you can now open your eyes. Very good. Next, we are going to inspect your chest. So just by looking at my patient, she doesn't have any labored breathing and she's not using any of her accessory muscles. So we'll go ahead and listen to your heart sound to the posterior and anterior, okay? So I will going to put my stethoscope at 5 different places. Aortic, pulmonic, Erb's point, tricuspid, and the mitral. Okay. Next, we're going to hear for the heart murmurs. So S1 and S2 were regular, no extra hard time, no murmurs were noted. Next, we're going ahead and listen to your lung sounds, okay? You just need to breathe in and breathe out, okay? Breathe in. Great. Breathe in. Great. Breathe in. Great. Breathe in. Okay, great. Now just go deep. Breathe in. Great. Here. Breathe in. Great. The other side also. Breathe in. Great. Side. Breathe in. Breathe in. Great. The other side. Breathe in. Okay, great. And now you breathe in. Yeah. Go. 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 Another. Go. The other side. Great. My patient lung sounds bilaterally are clear on her anterior and posterior chests. No adventitious sounds were noted. Next, we will be inspecting the abdomen. Inspecting the abdomen. Juliana, are you having any stomach issue?
No.
When was your last bowel movement?
Last morning.
Do you have any pain when you are peeing?
No.
Looking at my patient, I can tell that her contour is flat rounded, her umbilicus is midline, her skin is consistent throughout the whole area, no lumps, no lesions, no pulsations, and no hernias present. We are going to go ahead really quick and auscultate to see your abdominal aorta for any fluid. Now I'm just going to go ahead and auscultate all four quadrants. The patients does have active vowel sounds and all four quadrants. So next, I'm gonna go ahead and palpate your stomach to know if for any lumps or masses, okay?
Yes.
Do you feel any pain?
No.
So there is no pain or tenderness on palpation. Next, we will going to check for lower extremities. So there's no swelling, redness in my patient toes, and everything is look good. The two nails look healthy also. Next, I will going to palpate your popliteal. I will going to palpate your popliteal. So that is 2 plus. They are equal. Feeling her legs nice and warm. I'm going to push the tibia firmly. There's no edema. I will going to feel the pulses on her feet, but I will going to put my gloves on. We're going to feel the posterior tibial. And it is 2 plus. They are equal. Next, I will going to feel also the dorsalis pedis. And it is 2 plus also. The capillary refill, it is less than 3 seconds. Next, I want you to raise your legs against my resistance. Okay, good job. Now we're going to check the Babinski reflex, and we're looking for the toes to curl, and which would be a negative normal response. So let's check. So it's curl. So that is normal. Next, we are going to inspect the back. As I can see to my patient, there's no lesions, there's no moles, no wounds, and everything is normal. Okay, so we're now done with our head-to-toe assessment. Do you have any other questions before the doctor comes in?
None there.
Okay, thank you so much for your cooperation.